going to show you how to use the pulse oximetry. This lets you know how much oxygen that you have in your body. Of course, also at the same time, it lets you know what the patient's heart rate. So it's extremely important. This lets the doctors and nurses know, like, if your heart is moving too fast, too slow, and then how much oxygen. So if the patient needs more oxygen, then they'll deliver more oxygen. So today I'm just going to show you how to use the pulse oximetry. You have this one, which is like the ones they have in the hospital. Maybe if you're at a clinic, you'll have like this small one, but they both do the same thing. Of course, with this one, you can't see any numbers or anything. It's because this is connected to a monitor. So usually above the patient's head, there's always like a monitor that lets you know what the patient's blood pressure is, what the patient's heart rate is, the oxygen levels for the patient. So right now, today, I'm going to show you how to use this pulse oximeter. So you press the button right here, and as you can see, you're going to ask the patient to place their fingers in here, just like this. As you can see, the patient's oxygen level is at 97, so anything between 95 and 100 is considered normal. So right now I'm on 97, and then my heart rate is right here. The heart rate is showing 76 beats per minute, which is not bad at all. As you can see, my oxygen levels is 96, 97, roughly around there. All right, so now sometimes you can get a false reading if the person has nail polish. So if they do have nail polish or long nails, it could definitely give you a false reading. So it's extremely important. If you're in the hospital, whatever the case is, and you're using this pulse ox, patient's finger, right? So you place on the patient's finger, right? So let's say if you're looking at the screen and it's reading error, or if it's reading something that's really extremely low, like 50% on the oxygen level, it could be due to the oxygen. So like I said, if the oxygen level is really low, it could be due to the nail polish. A lot of hospitals and clinics, they do have nail polish removers, so you could just clean it off. Patient might complain, but at the same time, tell them, it's for their best interest. All right, so I'm gonna show you one more time how to use this. So this is the pulse oximetry. As you can see, this lets you know what your heart rate is. It lets you know how much oxygen is in the person's body. It is part of your skills. It's part of your vital signs. How do we get the oxygen levels? How do we know the patient's heart rate? By using this little small device right here. It's very useful. So I'm gonna show you how to use it. You place the patient's finger in here. Then you push this button right here. As you can see, then you wait for a few seconds, and it'll let you know what the patient's oxygen levels, where it says SVO. Can you read that? SVO. SVO is known as the oxygen levels. And this right here, this is the patient's heart rate. So as you can see, this is how many beats per minute. So right now, my heart is beating at 74 beats per minute, and my oxygen level is 97%. So the norm is 95 to 100 on the SVO level. The normal heart rate is anything between 60 to 100 beats per minute. That lets you know that your patient is pretty much stable. All right, so this is the ones that's used in the hospital. This is the ones that's pretty much used in clinics. You might see this in the hospital, depending on where you are in the hospital, but this is the one that's really used in the hospital that stays with the patient the entire time. Of course, they'll just wrap this around their finger, and this wire, of course, is connected to the monitor, which is above the bed. So you know how every single time you walk in and you see a patient in the hospital, and they usually have like a monitor above their head. That's pretty much what this is for. It's connected to that monitor, which lets you know the patient's heart rate, how much the oxygen level is. Of course, the patient could possibly be connected to the blood pressure cuff as well. So, and then that gives the nurse the full set of vitals.